Hi, my name is Ryan. I'm a student at Yale College. Today I'll be performing the task of intramuscular medication administration. So first we want to make sure you got the right supplies. I've got a 3 milliliter syringe, got a hypodermic needle that's 22 gauge and 1 inch. I've got gauze, I've got 2 alcohol preps, I've got 2 pair of gloves, and I've got a sharps container. Gloves just in case the other one rips. So we'll go over our 6 patient rights of medication administration. So right patient, right medication, right dose, right route, right time, and right documentation. We want to verify with the EHR and with the doctor's order in the EHR, make sure we got the correct dose for everything. Dose for this medication is 6 milligrams. It's morphine sulfate 6 milligrams per milliliter. The doctor is, 4 milligrams of morphine sulfate per milliliter. The doctor has ordered 6 milligrams, so it's 1.5 milliliters is what we're going to be pulling up in our syringe. Once we gather all the supplies, we will enter the patient's room, knock on the door, close the door behind us for patient privacy, perform a hand hygiene, introduce ourselves to the patient. Hi, my name is Ryan. I'll be your nurse today. Can you tell me your first and last name and date of birth? I'll check with their wristband, verifying the 2 patient identifiers. All right, nice to meet you. So today, the doctor has ordered morphine sulfate. Do you have any allergies? No? Great. So doctor's ordered morphine sulfate intramuscular. It's going to be a shot that we're going to be giving you. So morphine sulfate is it's a medication. It helps with moderate and severe pain. The mechanism of action is it binds to opioid receptors in your brain to block the nociceptors from feeling any pain. Some side effects could be nausea is a very common one. Could be headache and dizziness. Some adverse effects are respiratory depression, and any adverse effects you want us to tell us immediately if you feel any side effects, and we can let the doctor know, okay? So if you feel any, let us know. So respiratory depression, rapid heart rate, and hallucinations. Do you have any questions? No? Okay, well let's get started. So I'll perform hand hygiene again. I'll put gloves on. I'll get ready to drop my medications. So we'll grab our syringe, we'll pull everything out of a fresh pack. First I'm going to pop the top of our bottle of the morphine sulfate. I'm going to clean the top with alcohol prep, throw that in the trash. And then I'm going to put the syringe onto the top here, move it, and hold it in one hand. And with the bottom, we're going to pull up 1.5 milliliters of air. That's 1.5 mLs of air. Now the top has dried. We're going to remove the cap. Put that close over here, so we'll be doing the scoop method in a minute. We're going to inject it straight in without touching the tip to the medication. We're going to inject the 1.5 mLs of air, invert, and draw up the 1.5 mLs. And if we had any air, we did not have any air in there. If we did have air, while that's on, we would tap it and remove the air and inject in. If there's too much, we can inject all the everything back in and redraw it again. But there was no air, so it's our 1.5 mLs of the morphine sulfate. So I'm going to put it down because we're going to. So I'm going to do the scoop method here to recap this. I'm going to put this down on a clean surface. And we're going to look for our site now. So our site is going to be the ventrogluteal area on the patient. So to find our anatomical position, we're going to put the heel of our palm on the head of the greater trochanter and use our index finger, our pinky fingers to be pointing towards their buttock, and the thumb is going to be pointing towards the front of the leg. So heel of the palm on the greater trochanter back there, and then we use our index finger to point towards the anterior iliac crest. And so we're going to be making a V right here, and in between the V, right here is our target. So right here between our fingers, right there's our target. Now I'm going to assess the site, make sure there's no swelling, redness, any tenderness, any edema. If there is that, or if this is a site that's too commonly used, we would use a different site, but this site looks great. So we'll use our second alcohol prep, and I'm going to clean from inside out in a circular motion about 2 inches, and then we're not going to touch it again. So cleaning inside out, dispose of that. We're going to let that dry. After that's dried, we're going to remove the cap. I'm going to hold it like a dart, and my ulnar side be holding down here and pulling taut, and I'm going to use my index and forefinger to pull taut the muscle. We still got a clean area between here, and I'm going to pull the skin taut and show the muscle better. Come down at a 90-degree angle, straight into it. There we are. And while still keeping the pressure there, I'm going to be holding the tip of the syringe. I'm going to aspirate to look for blood. There is no blood, so we're going to slowly inject for 10 seconds per milliliter. And after 10 seconds is up, we're going to keep it in there for another 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're going to remove and put the gauze over. We're not going to massage, we're not going to hold anything. This is immediately going to go into our sharps container. And then we're going to, again, no pressure, you're not massaging or anything. We're looking to make sure there's no bleeding. There's no bleeding. It looks good. We're going to remove our gloves, perform hand hygiene, clean up our stuff, make sure the patient's comfortable, make sure they're comfortable position, got their call light, and we're going to document what we've done, and voila, we have done intramuscular injection.